always have to be with like one finger, or can it
Depends on
be
how
like,
old.
Yeah,
like our son
Mhm.
goes like this. Like he would just reach his arms out, but he wouldn't point.
How old is he?
Yeah.
You said you're
20.
okay. Yeah.
They do start pointing with one finger, right? That's more of like a fine motor planning. It's not really in our realm of things, but at that age they do point with one finger.
So what you could do, you know, I literally take a child's fingers and just tap them back so that they know to point. And you can also get toys that are push button that requires just, you know, one finger to push, so that they're exercising and learning how to use their pointing finger. And I mean, this is not necessarily our area, it's more of an occupational therapist, but you guys can try it at home. And I've done it too, just for speech purposes. I've taken kids who have low tone and need physical therapy and occupational therapy, and I'm sitting there teaching them how to use one finger. And then I always get the kid who uses the middle finger for some reason and points to everything with their middle finger. And so again, I take the fingers, tap them back, and make sure that they're using their index.
So it's not just intentions, but we will have to see the finger.
Right? It's also very specific. So it's very specific communication rather than just reaching. This is now very intentional pointing to things. So it's like a different level of communication. So try. I mean, even if they're using their whole hand, you could just tap it back. Or if you're helping them point to pictures in a book, like something just very simple, and hold their fingers, you know, you could just tap it, and they usually just do it. They start to do it. And you always remind them what they're doing. Say, good pointing to that. So they begin to associate that using this finger is pointing, and that's what you're looking for.
And speaking of pointing in a book, you know, we wrote reading, of course. You know, we understand that a lot of children don't sit there for a long period of time, especially when they're, you know, especially under 2, even over 2, sometimes it's difficult. But, you know, just try to make it a part of your day as much as you can, even if it is only 5 minutes, even if it's only 2 minutes, you know. You could even do it in the back when you know they can't go anywhere. But in terms of pointing, so let's say they're not saying that much yet, but at least try to have them maybe find some familiar objects in a book. Oh, where's the cat? Point to the cat. And once again, if they don't do it by themselves, grab their hand and do it with them. So working on receptive language in that way.